Hi everybody. In this video I will talk about the lab model articulation. So first we start with the shoulder. So this is the anterior view of the shoulder. So the best way to look at the articulations, first recognize bones. So this is scapula, and this area is the glenoid cavity, and this is the humerus bone, and this is the head of the humerus. So they articulate here in this area behind the capsule. This is the coracoid process of scapula, and this is the acromion of scapula, and this is the clavicle. So once you recognize the bones, the rest is easy. So you can see the joint capsule anteriorly, and also there is a ligament that is coming from the glenoid cavity area all the way to the humerus. So that's viewable in the anterior part of this joint capsule. So you don't see this in the posterior view. So the anterior part of the joint capsule is thicker, and that's because of the glenohumeral ligament. Then is the coracoclavicular ligament. So if you find coracoid process and then you find the clavicle, then these two are the ligaments there. This is the trapezoid ligament, and this is the conoid ligament, both of them together. That is the coracoclavicular ligament. Then is the coracoacromial. So this is the coracoid and this is the acromion, so this is the ligament. And then is the acromioclavicular. So this is the acromion, this is the clavicle, so this is the acromioclavicular ligament. This is the biceps tendon. So this is the lesser tubercle, this is the greater tubercle, and this area behind the tendon is the intertubercular sulcus. So the biceps tendon runs through that. And in the background you can see the supraspinatus muscle tendon. There is also another ligament, it's called coracohumeral, that comes like this. It's not in this model, but it's in the same area. And this is a different model, same anterior view. So you can see the joint capsule here and the glenohumeral ligament, the coracoclavicular ligament, the coracoacromial ligament, and acromioclavicular ligament. You see the biceps brachii muscle tendon. And this is the lateral view of the shoulder joint or glenohumeral joint. So coracoacromial. Okay, so find the coracoid process and then you find the acromion, so coracoacromial. Then is the coracoclavicular, so the background. This is the coracoid process, this is the clavicle, so this is the coracoclavicular. And this is acromion, this is clavicle, so acromioclavicular ligament. This is the biceps tendon, so the biceps brachii muscle tendon, same thing. And this is the, again, the coracohumeral will be like this. It's coming from this area and then comes like this. So I put it here. In this model, you do not see it properly, but this is the area. And this is the supraspinatus muscle tendon. So this is the posterior view. How do you know this is the posterior view? So you look at the spine of the scapula. This is the supraspinous fossa, this is the infraspinous fossa, and this is the acromion. Same thing here. This is the infraspinous fossa, this is the supraspinous fossa, this is the spine, and this is the acromion. So joint capsule, again, same thing. You don't have the glenohumeral ligament in this view, you do not. Infraspinous muscle tendon. So infraspinatus muscle attaches here. acromioclavicular. So from acromion it goes to the clavicle. So this is acromion, it goes to the clavicle. It's hard to see it in this view. This is the superior view. So this is clavicle, and this is the acromion, and this is the acromioclavicular. This is the spine, and this is the supraspinous fossa. And the coracoacromial. So from coracoid it goes to the acromial. This is coracoid, acromial. So elbow, look at the bones. So this is the humerus. This is the radius. See, this is the radial head. So radius is located laterally, and this is ulna. So this is the radial collateral ligament or lateral collateral ligament, same thing. This is the annular ligament. You see the head of the radius, annular ligaments like a ring. Also in this area, tendon of the triceps muscle. Triceps muscle comes all the way, and this is the olecranon of ulna attaches there. The joint capsule is around this area as well. Okay, so again, look at the muscle. So this is the humerus, and this is the trochlea. This is the capitulum of trochlea, which is located laterally, and this is the head of radius bone. So radius bone again is lateral in the anatomical position. So the radial collateral ligament and the annular ligament. Remember, the head of the radius articulates with the capitulum of humerus. So different view, look at it again at the bone. So this is the humerus, and this is the trochlea of humerus. This is the trochlear notch of ulna. This is the choroid process. This is the capitulum, and this is the head of the radius. So this is radius lateral, this is ulna medial. So annular ligament again here. This is the biceps tendon. And this is because it's medial, so this is the ulnar collateral ligament or medial collateral ligament. Rest area is a little bit complicated because there is a lot of small ligaments. So this is the palmar view. So before that, let me explain the bones. So this is the radius. Okay, so located laterally. This is the thumb. So both of them are lateral. And this is the ulna. And these are the carpal bones behind the ligaments, and this is the carpal bone, metacarpal bones, and these are the phalanges. So carpal bones, metacarpal bones, and phalanges. So palmar radioulnar ligament. Okay, so this is connecting the radius and ulna. So this is radius, this is ulna. So this is the palmar radioulnar ligament. Then is the palmar radiocarpal. So this is the radius, these are carpal bones. So this one and this one, these two. And palmar ulnar carpal ligament. So this is ulna, and this is the carpal bones, and this is the ligament. Radial collateral ligament. So this is connecting the distal part of the radius to the carpal bones. And this is a little bit difficult to see in this view. So this is ulnar collateral ligament, the medial side. Palmar intercarpal ligaments and carpometacarpal ligaments is in this area. So there's a lot of smaller ones here. The intercarpal ligaments, they are connecting the carpal bones, and carpometacarpal is connecting the carpal bones with the metacarpal bones. So it's in this area. And they also have different names. Some of them have different names. And then these are the metacarpal ligaments, these ones. So this is the dorsal view. So this is the radius located laterally. This is the thumb located laterally. This is ulna located medially. Carpal bones are here. Metacarpal bones, so there are 5 of them. And phalanges, there are 14 of them. So the dorsal radioulnar ligaments, the same idea that was in the palmar side. This is the ligament, this is the radioulnar joint is located there as well. So distal radioulnar joint, and this is the ligament connecting the 2 bones. Dorsal radiocarpal, so this is the radius bone, and these are the carpal bones, so this one. And radial collateral ligament, so this is the radius bone, and these are carpal bones, so this is located laterally. Ulnar collateral ligament, so this is ulna, and this is connecting ulna to the carpal bones located medially. Dorsal intercarpal bones and carpometacarpal ligaments, and dorsal intercarpal ligaments and carpometacarpal ligaments are here. It's the same thing that was in the ventral view, a palmar view of the hand, the same idea here. Connecting the intercarpal bones and also carpal bones with the metacarpal bones. And finally, metacarpal ligaments. So the hip, I put 2 different models because a little bit different in these 2 models. So look at the bones again. So this is ilium that is located superiorly, and this is the pubis, okay, and this is ischium or ischium, and this is femur. So this is the greater trochanter, this is the lesser trochanter. The background, you can see the head of the femur, and this is the neck of the femur. Same thing, this is the greater trochanter, and this is lesser trochanter. By the way, if you look at it here, this is the posterior view so of the pelvic bones. So this is the greater sciatic notch. So that's easier way to recognize which is anterior, which is posterior. So the pubiofemoral ligaments. So from the pubis, from here to here, this is the pubis. Same thing here. And this is the pubiofemoral ligament. So from the pubis, it goes to the femur, so it's to the lesser trochanter. So it's easier to see in this view, but this model does not have it properly. So I put this model. Iliofemoral ligament. So it's from ilium goes to the femur. So this is ilium, and this one. These 2 together makes iliofemoral ligament. So in this model, anatomically, this is okay, but this is not correct. So this should come here, should end up here, and the pubiofemoral from here, it should come to here. So this model is not perfectly correct anatomically, but this model is better. So this is pubiofemoral, and these 2 are iliofemoral. These 2, we consider this iliofemoral, but anatomically this should have been a little bit here. Okay, so once again, the different view that you can look at it. So this is the ilium, and this is the ischium or ischium. The background is pubis, and this is femur, so greater and lesser trochanter. This is intertrochanteric line. This is the neck of the femur, and this area should be the head of the femur. Okay, so this area. And acetabulum should be there too. So iliofemoral, this one. So that's coming from, you can see part of it. This one. So it's coming from ilium all the way to the femur. And ischiofemoral. So this is the ischiofemoral. So this is the ischium. It's coming to the femur, this one. The knee joint is one of the most complicated joints in the body. It has a lot of features. So this is the anterior view. This is the quadriceps tendon. So from the four muscles comes a tendon and attaches to the patella anteriorly. This is the patellar ligament, so connecting patella with the tibial tuberosity of the tibia. So femur, tibia, the fibula, and then here you can see the background behind the tendon and the ligament is the patella. Fibular collateral ligament, so it's connecting femur with the fibula, so this is located laterally. And tibial collateral ligament, so it's connecting femur with the tibia, so this is the medial condyle of femur, this is medial condyle of tibia, so it's located medially. Another name for this is the medial collateral ligament, and another name for this is the lateral collateral ligament. This is the lateral meniscus, and this is the medial meniscus. So this is the lateral view. How do I know this is lateral? Because of fibula. So once again, this is the femur, and this is the tibia, and this is patella, but more closer to the image, you can see this is the fibula. So lateral view. So quadriceps tendon. This is quadriceps tendon. Patellar ligament. Fibular collateral ligament. Lateral meniscus. So this is the posterior view. So this is femur, and this is the medial condyle, this is the lateral condyle, and if you come here, this is tibia, and this is fibula. So you can see the fibular collateral ligament laterally, tibial collateral ligament medially. This is the lateral meniscus. This is the medial meniscus. This is the anterior cruciate ligament, and just this area goes anteriorly. And this is the posterior cruciate ligament. This thing that you see, this ligament, is called meniscofemoral ligament. I didn't put it here, but just in case if you want to know, meniscofemoral ligament. Once again, this is anterior cruciate, this is posterior cruciate. This is the medial view, so this is femur, this is tibia located medially, this is patella, and look at the fibula at the background. So quadriceps tendon once again, patellar ligament, so this is tibial tuberosity. And tibial collateral ligament located medially, so medial collateral ligament is another name, and medial meniscus here. Ankle, this model is not very good anatomically, but we will try our best to explain it. So one is the Achilles tendon. Achilles tendon is made of the gastrocnemius and soleus muscles together. and that goes all the way and connects to calcaneus. Extensor retinaculum, this is extensor retinaculum. Fibularis muscles, so you know that it's fibularis longus and brevis, so these are the muscles. Calcaneofibular ligament, so you have to look at the name of the bones first. So this is fibula and this is the calcaneus, okay? So calcaneofibular ligament. Extensor digitorum longus muscle. So these are the muscles. It's passing below the extensor retinaculum and looking, it's going to the four toes laterally. This is a tendon. Plantar aponeurosis is this one. And below the plantar aponeurosis, you will find the flexor digitorum brevis muscle. So this is another view. So Achilles tendon again. So extensor retinaculum. And you see in this one, okay, so this is the flexor retinaculum that you can see it medially. So this is the great toe, and this is flexor retinaculum, so you can see it medially, and this is the tibia. So three different ways that you can see that this is medial view. And tibiocalcaneal ligament, so tibia, calcaneus, and this one. And this is talus. This is the background, so it's hard to see it, okay? So there's different types of tibiotalar ligaments. So this is one here, and there's also one here, so it's difficult to see it in this view properly. But there's different three of them. Extensor hallucis longus. The extensor hallucis longus, hallux is the big toe. So it goes like this, and it should go like this, not here in the middle. And there is another muscle here, it's abductor muscle, abductor longus muscle of the big toe, or abductor hallucis muscle. It is going here, a little bit below. So this tendon, the way that they made it is in the middle, so it should have been a little bit higher. Plantar aponeurosis. And below that, flexor digitorum brevis muscle. You also have flexor digitorum longus. This is not a muscle video, but it's in the posterior compartment of the leg. And this is the anterior view of the ankle. So extensor retinaculum. So it's covering and covering these tendons, you see that? Extensor hallucis longus, so this should go all the way here. Extensor digitorum longus. You also have extensor digitorum brevis, so these, they are not shown here, but they are here around this area. And this is the inferior view of the ankle. So the most important thing that you see is the plantar aponeurosis. And below that you have the flexor digitorum brevis muscle. And medially you can see the flexor retinaculum. So thank you for watching this video. If you have any comment or question, please write it below and I try to answer it. If you like this video, so please subscribe to it, because I usually make new videos on a regular basis. And if you like a specific topic, just let me know. Thank you for watching, and see you next time.